Hi, my name's Caroline Harrow. I'm the CEO of Harmless and the Tomorrow Project, and we provide suicide prevention services. This week, my mind has been blown, completely and utterly blown. If you're wondering what's going on with mental health in the UK at this time, what I can tell you is that we're heading for a mental health crisis. Now, if you think that I'm being pessimistic, I am not. Pessimism would be anticipating the worst there's no evidence for. But with the rising cost of living and a reduction in the number of services that we have available for people who are struggling, we're going to see a mental health crisis in this country. Over the last week, the government have announced that they are scrapping their 10-year mental health strategy. What this means for us, I do not yet know. But what it does mean is that there's been a removal of the strategy that drove the government's commitment to delivering a better standard of mental health care for all, and also working to prevent mental health problems and the issues that contribute to the development of mental health problems through training and other initiatives. That's all gone now. What can you expect to see? Well, you can expect to see more strikes. You can expect to see services like mine be squashed to the point of inexistence. We are not getting any rise in the amount of money that we are given to deliver the same level of services. So our costs go up. We get the same amount of money, so our costs go up, so we can deliver less. We can't deliver the same amount of quality of sessions to people in distress. We can't do any of that unless we get paid for that work, and we're not going to be paid at a suitable amount. So when the government have a strategy, when they have a plan, it's there to drive their commitment, it's there to drive their spending, and it's there to commission the right services so that against a need, whether that health or otherwise, there is a service that is there to respond to that need. If we take away the strategy, I'm not sure what there is saying these are the things we must do. This is how we're going to help people. We are committed to recovery. We want people to have access to crisis services, and we're going to do whatever we can to reduce the burden of mental health on our society. We are expected to see a suicide prevention strategy, but if you, like me, believe that early intervention is everything, it's absolutely everything, then we're shutting the stable door after the horse has bolted if we're only going to deal with the critical end of services when people are already at the point where they're considering taking their own lives. If it's got that far, then we have failed those people already by not providing them with the right education, support and access to services throughout all the problems that they may have been facing thus far. This is not acceptable, it's not good enough, and something has to change. This is not rocket science. If there is a rising problem, there needs to be a rising increase in the amount of support available for that problem. Otherwise, people are going to die.